I'm a bit vertically challenged, so this down. Thank you for inviting me and sharing the work that we have been doing over the last 10 years now in the Cheshire and Merseyside network in particular, but North West Coast network is included in that. My name is up there, but I must say that two of my very close associate specialist colleagues in Cheshire and Merseyside, Ezra Suleimani and Helen Bonwick, have done a huge amount of work to support what I'm going to describe to you today, and their work is ongoing. So I just wanted to make sure that people knew that this wasn't just me that was doing this. So why am I so concerned about the development of SAS doctors? Well, if you look at my title there, you might think that I've come from the rarefied atmosphere of specialist training, but I didn't. I was a GP for 8 years, and I was a staff grade doctor, as they were previously known, for 13 years, and I did both for a period of time. And then I gained a CSER through, a Certificate of Equivalent Specialist Registration, through a lot of hard work, and I have to say it's harder now for people who are wanting to do that, and I was successful in doing that in 2009, so I've been a consultant since 2009. So what do I think the issues are with regards to the issues for specialty and associate specialist doctors? Well, we all know that there are many workforce pressures that exist across all specialties, and recruitment and retention, as we're talking about today, is a huge challenge, and it's a huge challenge in particular for hospices. In Cheshire and Merseyside in 2022, we conducted a workforce review, and that is one of the resources that you can have a look at later if you want to. We'll share that with you. But that basically showed that we had a 20 whole-time equivalent gap in the consultant-only workforce. That didn't include gaps in the SAS doctor workforce at all, of which there was a significant one of around 6 whole-time equivalents. We also found that very rarely were there any SAS doctors in the hospital setting. So we don't have the workforce for what we need to do now, and we certainly don't have the workforce for what we're going to need to do in the future. Some of you will be aware of what's happening with regards to the training of future consultants in palliative medicine, and shape of training it has the potential to make a really huge difference. We've seen applications for training fall off a cliff this year, and given that we've got a 20 whole-time equivalent gap now, and in Cheshire and Merseyside we've only got one doctor in training likely to come out in 2024, you can see the issues we've got. The particular issues for SAS doctors, many of you will be aware because you might be one yourself, is that they have fewer opportunities for career development compared to doctors in specialist training, and often they can be unsure where they get any guidance even to do that comes from. The other thing that particularly has concerned me over a number of years is that specialty grade doctors can often be asked, within hospices in particular I think, to step up into clinical leadership roles without the support or training to do that. And as I've just alluded to before, we know that the population need for palliative care services is going to increase hugely by approximately 40% in the next years. So we've got a real problem on our hands. So if you look at the SAS doctor establishment in hospices in particular, what we know is that they've got a huge amount of experience. Often they're not just doctors in hospices, they bring experience from general practice and elsewhere, which is hugely valuable. We do know that their interest in career progression is often really high. We do know that most specialty grade doctors work in hospices, some in community settings as well, but very few actually in the hospital setting. We do know that job plans, where they exist, and I say that advisedly because actually SAS doctors tell us that sometimes they don't have any kind of written job plan or even contract. they're often service provision focused. So you are appointed to do the do. You're appointed to see the patients. You're not appointed to do quality improvement work, audit, education and training, although a lot of them do. And then one of the nubs of the problem is, I'm sure you will always all be aware of, is that pay and terms and conditions in hospices in particular is very rarely fully aligned to the NHS, and I include my hospice in that. The GMC workforce report from just this year talked about SAS doctors in general, and said that they were a significant percentage of the workforce and likely to be the majority by the end of this decade. More SAS doctors leave the profession than any other grade of doctor, but that they repeatedly report barriers that hinder their development, some of which I've just mentioned. And they have said that it's imperative to address career progression, education and training for specialty doctors. So what is the position of the Cheshire and Merseyside network? Well, what we acknowledge is that SAS doctors often have skills and knowledge, sometimes at or above colleagues who are consultants or specialist training roles, but this often not valued or recognised. SAS doctors can have particular challenges when accessing opportunities for professional development due to funding and service pressures in the voluntary sector. So we may well all wish to develop our SAS doctors, but funding issues, being charitable organisations, is always there. However, supporting the education and training of SAS doctors and benefits for patients and the wider system means that we're going to be providing better, safe and effective and sustainable services. So since 2012, Cheshire and Merseyside Palliative and End-of-Life Care Network has worked to support SAS doctors in our region to access training and development guidance and opportunities, and I'll go through some of that. So there are some key enablers that we've put in place, some of which are available for use nationally and regionally. Early on in 2014, Helen and Ezra developed a framework for SAS doctors, which was a 4-year framework of training which described what good would look like. Now that was mainly to look at somebody who might want to submit a CSER application and mimicked the 4-year training that a consultant, a potential consultant would be doing. But it's quite a practical guide. That has been available since 2014 and it's now in its 3rd iteration, so it's updated in 2020. And again, that's available for use and it's one of the resources that we can share with you. We also made sure that there was a SAS doctor representative, which is currently Helen, on our educational supervisors group, Northwest Educational Supervisors Group, to ensure that their issues and their development needs were discussed with and alongside those of doctors in specialist training. And that has had a huge impact, and I'll explain a little bit in a minute. We also made sure that SAS doctors had the opportunity to be part of the education and training programme that specialist trainees had. Interestingly, there was a little bit of reservation in terms of including doctors who weren't in specialist training, but now they've engaged really well. The problem is, it's often them who have to stay back at the ranch while the specialist goes and gets the training, but we're working on it. And actually the pandemic has made a huge difference because now it's virtual and they can tap into that, and they can tap into recordings, which has really, really helped. And we've also created a network, a SAS doctor group, which we support with a little bit of money and some admin and project management. So some other things that we do. So the SAS doctors now have quarterly meetings and development away days to help them think about their own needs, to talk collectively about what would help. They conducted a survey themselves, and out of that they told us that they would like to be able to rotate between different organisations and get experience elsewhere, in another hospice, in a hospital, in a community setting. So we set up a working group to make that happen. And actually since then, a number of doctors have completed rotations elsewhere. So we do a matching exercise, and 2 of my doctors already have been over to our tertiary cancer centre to get experience there, and 1 of the doctors came over to us, and it was really beneficial for everybody. And so we're going to do more of those in the future. We've also developed a framework, and I think this is a really big piece of work that some of you might be really quite interested in, to assess responsible clinicians and medical directors in hospices who were not on the specialist register. Prior to this, there was nothing that would actually describe what the competencies were for somebody who wasn't on the specialist register but wanted to be a responsible clinician or a medical director. I can't go through this in detail. It's quite a detailed framework, but essentially we have a 3-step process. So the doctor benchmarks themselves in terms of their training experience against the framework that I mentioned earlier that Helen and Ezra had put together. The employing organisation is then asked to conduct an appraisal against that and to make sure that they have a job plan that meets their needs, and we ask the employing organisation to sign up to that. Then that's submitted for an external assessment. This isn't an accreditation, but is actually a quality mark, if you like, and that's what we're trying to work towards. And this framework has now been recommended and included in the Palliative and End-of-Life Care Handbook for Integrated Care Boards. So what impact have we had? Well, SAS doctors across our network tell us that they feel recognised for the significant contribution that they make in the provision of specialist palliative care services. They've been empowered to seek opportunities for their own development into clinical leaders in their organisations, and we've currently got 4 doctors across the network who are actively looking to submit CSER applications to get onto the specialist register in the next 18 months, which, when you think that we only had 1 doctor coming out in 2024, is really, really important. And also our frameworks have been adopted regionally and nationally as good practice guidance. So what next? Well, we want to increase rotation opportunities. We want to get them out more and more. I've just learned this week that the bar for hospital experience is changing, it's increasing. How do we get that when very few doctors in SAS doctor roles actually work in hospital settings? We need to think innovatively about that. And we've just done a piece of work on the key principles that describe ideal medical establishment in hospices, both in and out of hours. So what can you do? Well, ask yourselves these questions. How do we fare against the SAS Doctor Charter? Anybody here actually know that what the SAS Doctor Charter is? Because it's not my charter. It's a national charter for all SAS doctors, and it's a benchmarking exercise. I would suggest that you maybe go away and see if your organisation employs your SAS doctors against that, those. Think, what can we do to improve job experience and job opportunities? Ask your doctors what good looks like. I was at a conference last week, a leadership conference, where they were talking about the joy of job crafting and asking people what it is that they need and want from their job role. Because if we do that, we keep people happy and in their roles, and they don't want to move on. And then think, can you collaborate further with other hospices, other organisations to maximise the career development opportunities and make the most of the individuals that you've often got working within your organisations? So these are the references and resources that we'd be happy to share, and these are the email addresses for the 3 of us if anyone would like to ask any questions. And I've put any questions, but I'm going to come back and wait for the others. Thank you.
So myself and Vanessa can't hear audio sometimes from the auditorium. All I can currently see is Vanessa, which doesn't help because she's in the same boat as me, you, Rowena, and a bird's eye view of the auditorium. So either, if you can't hear me, Rowena, stick your hands in the air, or delegates, if you can change seats and form yourselves into the word stop as seen from above, that'd be perfect. So Rowena, just to check before I go ahead, arm in the air if you can hear me. Hey, lovely. Right, so where are we in terms of recruitment? As I say, if you've tried recruiting yourselves recently, it is pretty bleak at the moment. I've never known it like this. Applicant numbers have dropped through the floor for most roles, um, but there are some obvious reasons for it. So a lot of it is our sector is less attractive than it used to be. We've had various scandals in sector organisations and central bodies which have put people off because they've hit national press. First jobbers and education leavers that I speak to, who traditionally would have been targeting the charity sector, I find are looking at other sectors like the tech industry now, because they're getting that sense of shared purpose, that sort of cool factor that people would have traditionally targeted our sector for. And they get that sort of feeling they're giving something back through the corporate social responsibility that their corporates do. More people have left the sector. We've heard about the great resignation happening across the country during and post-COVID, but it's affected our sector more than others, because like other sectors that make a difference, like teaching and healthcare, and with hospices, it's a double whammy of charity sector and healthcare, our sector has always had more people in it than other sectors who are not the main breadwinner in their household. So it gives more flexibility to leave. So if the job is getting too hard, and there are plenty of jobs, as I'm sure some of you know, that are doing two people's job in one, or it's too stressful, people have just found it easy to take early retirement or just walk away and take something closer to home that's easier. Then you've got uncertainty. As a recruiter, you would always see that applicant numbers would drop when you're coming up to a general election or something like that, because people wanted to see what was going to come out of the new government and funding and things like that, so they stayed put. Now, we've not had a general election, we've had Brexit and a pandemic, so there's all this uncertainty, which means people are tending to move less, and the best people are being looked after by their employers, which is a good thing. But when you're recruiting, it's not a good thing, because you're drawing from a more limited pool from before. And in terms of people who are job seeking right now, the things that are important are flexibility more than anything. And that doesn't just mean letting people work at home one day a week. It means being as flexible as you possibly can and trusting people to work more effectively at home. And that trust counts for so much. And for those worried about productivity, and I still hear this a lot, I've been banging the flexibility drum for more than 15 years, I think, because I truly believe you get more productivity because it forces your managers to manage people based on outputs rather than on presenteeism. And we've all seen those people looking busy at their desk, achieving nothing all day, right? Salaries have to be fair. Gone are the days when you could say, although I still hear it a lot, we're an amazing charity, people come to us even if the salary is lower. They just won't see your ad anymore because people aren't looking in print anymore. They're looking on websites. So they're putting in, as I'm sure you do when you job search, looking at a salary range. And if they're putting in 30 to 35 and your job's 28, however good your charity is, and you might be next door to where they live, they simply won't see your role. So your salaries have to be fair and equitable with others that are paying. But even a small amount can make a difference. So you see a lot of salary scales that are paying something like 29,995 as the top end. But if you just add £6 to that salary, you're tipping over 30,000. So you're going to see that whole other tranche of people who have put in a field of 30 to 35,000, say, in their job search. So think about even those small amounts of money. Also, applicants looking now are hyper aware of criteria being appropriate to the role they're looking at, and they're calling it out when it isn't. So if you're asking for a degree when it's not necessary, or a certain number of years experience, you need to get rid of all that, because not only is it stopping people applying, but you're going to get called out on social media and it's going to impact you as a brand. So I am conscious that not only do I speak quickly, but this has been really doom and gloom so far, but it really isn't all doom and gloom by any means. It is hard, but most organisations are rubbish at this. So if you're just a bit better, you can really stand out from the crowd, and you only need one person for each job. And as long as you get yourself in front of them, keep them engaged, that is really all you need. So how to get them engaged? Well, firstly, with marketing, it's your job pack. This is absolutely a marketing document. It's not just a list of responsibilities. You need to make it sell your role. So the first easy solution, and really the key thing within this, is not only providing information, but removing fear of the unknown. So get an org chart into your job spec. There are some people out there who say love being in a team of 4, all of which are doing the same thing and can bounce off each other. And there's others who like being the one person in the organization, having total autonomy and doing their thing. But if you're not clear on your job pack, which of yours that your role is, both of those people may choose not to apply because they just don't know whether it's for them or not. You can also, the line manager role, we all know is probably the most important relationship in a role, but often you just see the person's job title. Include a biography of that line manager, put a link to their LinkedIn. You could do a video and put it on YouTube of them talking about the role and put a link to that. Everyone's looking at these things on tablets, laptops, smartphones. You can make them interactive and really bring them to life. They're not printing them out anymore. Get something in about the team and maybe the work they've done recently. If there's a link to some of the work they've done, put that in as well. Show what the office looks like. Just all you're trying to do the whole time is bring the role to life and allowing them to picture themselves in that role. And think about the selling points of the role. If it's an existing role and it's doing really well and it's successful, put that into the job pack. If it's a brand new role, get in the reason about why it's been created in the first place and what things are in place to make sure it succeeds. So add in all those good bits, and you know what they are because you care about those things when you're job searching. Get in all the good bits, get rid of all that non-essential criteria. As I said, I'm still seeing roles with 15 or 20 essential criteria, and they're clearly not. Get rid of degrees, driving licenses, all of those things. But you really only need 5 or 6 criteria. That's truly the essential criteria. If you whittle it down to those, it makes your shortlisting and interview scoring way easier, and it will increase the number of applicants so you've got more people to look at and choose who you think is the best fit. Finally, include your benefits, not shopping discounts and cycle to work schemes, because frankly, nobody cares about those enough to make a difference about whether they apply or not. What they want to know is parental leave, pension, and annual leave. Those are the only 3 important things, and you need to get those in so people don't feel they need to contact you to ask about them. So you've got your job pack, it tells a story, it'll encourage good people to apply, but now you need to get them to look at it. So you need to get an advert out there. So similarly, once you've done the job pack, it's really easy because you're just using that in a more concise form. You get your selling points to the role and you get those front and center. You get your actually essential criteria in there, because if there's only 5 or 6, you can get them in the ad and then people know whether they are actually right to apply for it or not. You can put a quote from a member of staff. It's really powerful, this. You can put it in the job pack as well. If the person who's leaving the role or an existing team member likes where they work, get a quote from them, put it in. It really endorses the role and makes people buy into it and believe it. And if, like so many organizations, you have slightly weird job titles which don't really say what the role is and aren't what other organizations call that job, just use a generic job title on the ad. It doesn't matter. And it's pointless you using your weird job title that everyone in your organization knows if nobody's going to understand what it is and see it. Once you've done your ad, yes, get it on a standard job site. They do work. Job seekers use them. But you want to get to all those passive people who aren't necessarily looking. So use social media and completely hammer it. So put it on the jobs page on your website, then ask your staff to share it on the social media they use, whether it be LinkedIn, Twitter, Facebook groups if they use Facebook for work-based stuff. But don't just get them to share the ad, get them to write a bit of narrative about what they feel about working there, because then that not only promotes that role and makes people within their network more likely to apply, it also just sells you as an employer of choice and starts building your brand as an employer. And finally, put your contact details on the ad. Not that many people call you, but it will be the good ones who call you. And knowing people can call, A, makes people trust the role more because they know it's being open and that you're willing to take questions, so they almost don't feel the need to ask them. And those that do, you get a chance to have back and forth. You get to understand a bit about them, and they get to ask those questions they need to know before they apply. And it will be the good ones that do that. So now I'm going to skip through some really fun parts like shortlisting, removing bias, how to interview well, all those kind of things, and actually jump to the riskiest part of the process, making the offer. And I will talk about Wednesdays. So you've interviewed, you decided who your favorite candidates are, and notice I'm saying candidates rather than candidate because it is plural. You ideally want a second choice and a third choice. If you can, don't fixate on just one person. Doing this well is amazing. It's incredibly high risk, and that's what you're taught as a recruiter all the time. This is the riskiest part of the process. Everything you've invested, the money, the stress, all the time, all of it hinges on doing this moment well. And if you do it well, it's lovely. I miss this part of being a recruiter so much because, you know, you phone people up, they squeal, they shout, they cry in a good way. It's lovely. But you've got to have a bit of thought about it first. And firstly, it's often HR that do it. Don't let HR do the nice bit. It should be the line manager doing it because you're the one who can answer questions if you need to. So train your line managers to have a bit of thought beforehand, because generally speaking, if the line manager calls up, they've got 2 thoughts in their head. They think, I want the person to accept, and maybe they're thinking about the start date, but you need to think about some other options. Because yes, if they phone up and the person says, that's great, lovely, jumps around, then that's easy. It's not done. but it's easy, you're halfway there. But they need to think about two other options that might happen when you phone and offer somebody the job. So if they phone up and they get voicemail, what can happen is the line manager leaves the job offer on someone's voicemail, which is the biggest world of nightmare you can have in recruitment, because if that person doesn't respond to that voicemail and call you back, you've just left a legally binding offer on someone's voicemail. How long do you leave it before you offer it to somebody else? Long enough that you're going to have lost all the other people you might want to offer to anyway. So don't leave offers on voicemails, but do ask them to call you back, and they will if they're interested in the job. The other option is that they say no thanks, which is totally fine. But if you haven't prepared for it, if a manager hasn't prepared for it, it's a pretty uncomfortable situation to be in. The person saying no feels uncomfortable. The line manager doesn't really know what to say. So generally, they both want to get off the phone really quickly. So they say, okay, that's fine, and put the phone down. And then you never getting that person back. But from my experience as a recruiter, very often, if you just know that it's okay to say to somebody, oh, that's fine, but can I just ask why? And ask them about it. Very often they just need a bit more information. They may have made an assumption in the process which wasn't correct. They might have another offer on the table. And then if you've got a good relationship, you can have a chat about that other offer and what it's like and the pros and cons. And they might choose yours in the end. And often it is just something as simple as, I had lots of cases where somebody would say, oh, no, I'm saying no to the job because actually I can't start for 2 months and I know they want somebody starting in a month. So they've said no just because they think it's too long. But obviously, you know that if they say no and you have to go back out to market, 3 months if you're lucky before you get another member of staff. So just managers need to think about just engaging with people if they say no. And usually speaking, you can turn them around. And if they do say no and you've done it in a quick fashion, you can move on to your second choice and a third choice. So you've got to do it quickly to do that. Otherwise, the longer you leave it, the longer everybody thinks, I haven't been contacted, I obviously didn't get the role, maybe I didn't want it anyway. And then when you do offer it, they're far less likely to say yes. Also, once you've done this, you've got your person, all of that, please don't forget to give feedback to the other people who have interviewed, because it happens so often and it's just unfair to people not to give them feedback when they've done an interview for you, but also it will get passed on to friends. Other people won't want to apply for you. And I've heard of more than one instance where somebody didn't get feedback, had a bad interview experience. Nobody knew that that person's uncle was a major donor of that charity, who subsequently didn't give their annual donation of tens of thousands of pounds after their nephew having a bad experience. So it can impact you financially as well. But it is just a fair thing to do anyway. Now, I did promise Wednesdays. I love Wednesdays for job offers. It makes all the difference. Most organisations do job offers on Fridays because they've interviewed in the week. They give a job offer on Friday. Friday is the worst day to do a job offer. Please try and avoid it. The reason Wednesdays are great is, if you imagine you've got a couple of options, you've got your first choice. If you phone up and offer them the job on Wednesday, most people will want to think about it overnight. That's fairly standard. So that person thinks about it overnight. Maybe they come back on Thursday and for whatever reason, they decide not to take the role. That's fine. You can't convince them, whatever. You then offer to your second choice, who's still interested because you've done it so quickly, remember, and then they think about it overnight. So on Friday morning, they phone in, accept, everyone's happy, but that means they can resign from their job they're in right now on a Friday. Now, if they're really good and you think they're great, their employer might think they're great as well. So that employer might want to keep them by offering them a pay rise, a promotion, whatever. But if that's happened on a Friday and they've resigned, it's very unlikely that employer is going to be able to turn around that offer or salary increase on a Friday. Therefore, your favoured person has the whole weekend in the headspace of being in your role, thinking ahead, thinking about the new role they're going into. So by the time they come back to work on Monday, even if they do receive a better offer, they are far, far less likely to accept it. I've been doing it that way for a long time now. Since I've done offers on Wednesdays, counter offers just don't tend to happen. So like with so many of these things, as I say, it's a tiny little tweak that costs you nothing, but can make an enormous difference. So I've mainly talked about recruitment. Retention is way better because if you retain your staff, you don't need to recruit as often. So it's easier and cheaper and happier. But as a sector, we are so bad at retention. And really, the most important thing is just to listen to your staff and what they need. And a way to start with this, if you don't do it already, is exit interviews. Still, lots of organisations don't do them. If you don't, you really need to start. But often in an exit interview, people get asked, why are you leaving? And they tend to say something like, oh, it's a career move. Don't ask them why they're leaving. The key thing to ask to get the information is to say, why did you decide to leave now rather than 6 months ago or in 6 months' time? That's the question that will get you the much more decent information from them. And then once you start to build up that information from exit interviews about why people decided to leave your organization, you can work out how to solve those things to make people want to stay. So that's the first bit of listening. The other thing is to train your managers to think about supervisions with staff, not as about monitoring how they're doing in the last month or so, but to actually engage with their team members and ask them where they want to be in 5 or 10 years' time. Don't ask them where they want to be in 2 years' time, because everybody will say to you, I want to be in this organization in a more senior role, because they think it feels somehow disloyal to say anything different. But if you say in 5 or 10 years, they'll feel much more comfortable to be a lot more honest. And as soon as that line manager knows some career aspirations of their member of staff, that is gold dust, because they can then start factoring in the role they're in right now as an active part of their career journey. And you can do that by letting them maybe work every now and again in other departments to give them different experience. And that is wonderful for them because you're looking after their career, but brilliant for you because it breaks down silos and it helps you share more information. So it mitigates against you losing information when people leave. Breaking down silos is a real passion of mine, and it works really, really effectively. Also, maybe the line manager could match them up with somebody relevant in their network as a mentor for that role they want to move to, or maybe within the hospice sector, which is where you could all work so much better. I mean, the gold dust of the hospice sector, where you've got similar organizations, share best practice between people doing similar roles, is wonderful, and you should all grab onto it with both hands. And encourage your staff to become trusted. And probably most of your charity boards don't have one member with any charity sector experience on them. So, and I think that's one of the root causes of a lot of the problems in our sector, from diversity to flexibility, all of those things. So if you encourage your staff to become trustees, then they will get brilliant experience. It'll really benefit your organization, that experience, and you'll be engaging with helping them to develop. And then coming back to that flexibility and trust piece, the organizations that I know who have the best staff retention are often the ones who have the most flexibility and trust within the organization. And once your staff have that and have that engagement with your culture, it can be really hard for them to find similar elsewhere. So that pay rise they could get by leaving your organization becomes far less attractive, because they don't just want the pay, they want the culture, they want the flexibility, and it's not worth them sacrificing their quality of life just for a few £1,000s more. And do remember that in your organization, probably in all of your organizations, it's likely you've got at least one person in the organization who has retention in their job description, but about donors rather than about staff. But all of the things that all the skills you need to use are pretty much exactly the same. It's just about engagement and connection. And you can engage with your staff and thank them and connect them to the cause. I mean, we all tell our supporters how their £10 per month makes a difference. But do we ever tell staff members that, about how their 37 hours per week makes a difference? If you do that and engage with those staff and make sure they feel connected and give them that flexibility and trust, they will stay far longer than they do. It's such a small thing in a way, but makes a massive difference. And if you do all these things and keep them engaged and happy, don't hide it, use it. Get the retention stats when they've improved into your job packs. Get your amazing culture into your adverts. Get your staff to talk on social media about how wonderful it is to work at your organization. And if you do all of this, then maybe new staff will start to seek you out rather than you always having to go out and find them yourselves when you're recruiting. So as I said, that is all very top line of the things you can do. I love helping organizations to do this kind of thing, because recruiting first time and holding on to your best staff, as I say, is generally free and easy, and using the skills you have yourself as a job seeker and that you have in-house when you're thinking about how to keep your supporters on board. And once you get it right, it can genuinely be a lot of fun. Thank you so much.
It's great to be here. Thanks for the invitation to contribute today to the session. And I'm going to try and fit in 3 initiatives that I'm involved in nationally and regionally to support recruitment, retention, and the development of palliative and end-of-life care workforce. And hopefully we'll see all the connections from our talks today, which have been fascinating. So looking forward to hearing questions at the end. So the 3 initiatives that I'm going to focus on do focus on the nursing and the allied health professions workforce for palliative and end-of-life care. The first one is a national project with NHS England developing what's called a qualification in specialty for palliative and end-of-life care. The second one is just an update on the work with Health Education England Centre for Advancing Practice on the development of a palliative and end-of-life care credential. And the third one is a regional project for North Eastern Yorkshire, which has the potential to become a national project, or certainly transferred to other regions around the development of the CNS workforce. So the first one, it started in 2021, and it has expanded from its original remit. The original proposal for the qualification in specialty from NHS England did just focus on registered nurses providing general and specialist palliative care, but we have extended the proposal, which I'll explain in a moment. The original proposal was around developing the level of knowledge and capability of those who provide general and specialist palliative care, and ensuring access to education and learning and development opportunities for both the future and the existing workforce. And in the original plan, we were focused around developing 2 modules which were proposed to set this minimum standard of knowledge and skill for the workforce. A foundations in palliative and end-of-life care for pre-registration students and the unregistered health and care workforce, and a fundamentals in palliative and end-of-life care module for the registered level workforce. I've used the word module there, but I'd like to explain that this really was just a framework for offering learning outcomes and a syllabus for the core knowledge that we anticipated the workforce would need to be able to provide both general and specialist palliative and end-of-life care, and to offer some guidance for assessment. And that development could be through an academic module, but also emphasising the importance of workplace-based learning, the use of e-learning, and a whole range of CPD opportunities. So not just necessarily an academic award. But as I say, the project has grown slightly, and we've now got an extended proposal, which probably fits in with much of what Paula and Paul have talked about in developing a career pathway and core capabilities in practice with an aligned education framework for palliative and end-of-life care workforce, both the generalist and the specialist workforce, creating an end-to-end career pathway depending on the aspirations of those who want to move into specialist palliative care, but also making sure that there's an aligned education framework which is commissioned and available to make sure that education and learning and developments are available for the opportunities to progress throughout someone's career as well. So there are 3 parts to the proposed framework, which include the career pathway. I'll talk a little bit more about them. The core palliative and end-of-life capabilities in practice, and the aligned education framework as well. So what we're focusing on in the career pathway is levels of practice, not specific roles. And the work now includes both nursing and allied health professions. The levels of practice that we're focusing on include the supportive, assistive, pre-registration, registration, enhanced, advanced, and consultant level practice. So we're drawing in national work around career pathways, but also the work that the Centre for Advancing Practice are working on for the advanced and consultant level practice. So trying to put all the pieces of the jigsaw together of the work that's going on nationally around career pathways. The core capabilities in practice are workplace-based knowledge and skills, and these are aligned to each of the different levels of practice in the career pathway, and also represent the 4 pillars of professional practice. And I think Paula mentioned these: the clinical, the education, the leadership, and the research expectations of practitioners in their everyday roles. The education framework that underpins all of this makes sure that we can align the knowledge and skill outcomes, the learning outcomes, the syllabus and the recommended assessment for each level of practice, and as I say, aligned to national frameworks for advanced and consultant level practice for the nursing and allied health profession workforce. Again, it's presented in module format, but as you can see in the parenthesis, that this is about just a framework for offering learning outcomes, doesn't necessarily mean an academic award. Although these things, if they are within a higher education institution, can be then added together to create a course such as a postgraduate certificate or diploma, depending on the expectations of the individual practitioner or their employer for some additional learning. I'll talk a little bit more about the credential for palliative and end-of-life care in a moment. So in pictorial form, this represents all of the things that bring together the career pathway, the core capabilities and the education framework. You can see it focuses on that general and specialist palliative and end-of-life care workforce, bringing together the 4 pillars of professional practice and the different levels at which the career pathway offers that route through, and also identifying and reinforcing the learning and development can be through a range of learning opportunities, not just through academic award. The core capabilities that we're focusing on include these key aspects of palliative and end-of-life care, and they will develop, deepen and build the knowledge and skills of the practitioner as they progress along the career pathway, with a shifting focus from individual patient care through to service for a group of patients and families, through to organisation and system level practice. In addition to that, this is a bit of a busy slide, apologies for that. It's the education framework. You can see the 2 modules that were originally proposed included here as core modules, and then the opportunity to add to these with some additional learning relevant to somebody's role or their employer needs, to build up in a flexible way a framework for education relevant to that particular practitioner or employer, and to help them to advance and develop to meet their particular career aspirations. And this diagram really just reinforces that. You can see the first column for the registered practitioner, the core module, and then the next level up, the enhanced practitioner, adding in perhaps some specific learning around communication skills or psychological support, and then starting at the advanced and consultant level, meeting the HEE Centre for Advancing Practice requirements for advanced practice, plus the credential for palliative and end-of-life care at both the advanced level and consultant level practice. So really that flexible framework, building that career pathway, and hopefully supporting recruitment and retention into the workforce. So where we're at now with this particular project is, some of you may have contributed to a survey that was distributed over the summer establishing demand. So thank you if you did. We're currently looking through that feedback. We're working with the commissioning process at NHS England to develop the commissioning process for these modules and this career pathway in the education framework, and also starting to review the career pathway, core capabilities and education framework to go out to wider consultation. So please do have a look out for that, and we very much welcome your feedback and comments in the future. The second part of the work is the credential for the advanced practitioner in palliative and end-of-life care. This work took place during 2019 to 21, and we had an open consultation and received lots of feedback from practitioners, both specialists, generalists, and also from families, patients, carers, which was really helpful in developing the credential, which identifies area-specific knowledge and capabilities in palliative and end-of-life care for the advanced level practitioner, both nursing and allied health professions. And these are achieved in addition to the generic capabilities that the centre sets out for anyone practising at an advanced level. And from June 2022, the credential was approved, and we're currently waiting for that to be published, and we'll be developing a communication and implementation plan with the Centre for Advancing Practice in the next few months. So please have a look out for that. The credential itself includes lots of information, including a curriculum and the capabilities in practice, but it also includes guidance around workplace-based supervision and assessment, and for the practitioners to record their information in a practice portfolio and what criteria they need to meet to complete their training and be recognised as an advanced practitioner in palliative and end-of-life care through the Centre for Advancing Practice. Someone can achieve that status of advanced practitioner in palliative and end-of-life care through three main routes. One is through undertaking the MSc in advanced practice and the generic capabilities, and then the palliative and end-of-life care capabilities after that. Or they can undertake a programme where the palliative and end-of-life care pathway is incorporated within an MSc of advanced practice, or there is a separate portfolio of evidence route. And all the information will be available on the Centre's website once the credential is published. The final project, conscious of time, is the focus of the developing the specialist palliative care CNS workforce. This is originally a regional project for the northeastern Yorkshire, and as I say, has the potential to extend beyond that nationally to address some of the recruitment and retention challenges that some of you are probably familiar with in recruiting to CNS posts. And this was something that brought together the specialist palliative care services initially across West Yorkshire, coming together to address the challenges where they were all individually trying to provide training programs, around induction for CNSs, and which was taking a considerable amount of time and pressure on the current workforce. And also when people moved around different services, they were undergoing the same programme in a different organisation. They also realised that access to specialist education and training for the new CNSs was very limited and often cost prohibitive for the charitable sector. So drawing on the word, I think it was Paula and Paul talked about the opportunity for collaboration. The services did work together across West Yorkshire and now across northeastern Yorkshire to create a collaborative programme for the development of clinical nurse specialists newly appointed within the first 2 years, and secured some funding from Health Education England to pilot that. The programme is for new CNSs and also and involves using the Echo platform to offer a series of learning opportunities and a practice portfolio of evidence for the new CNSs. So what they've achieved, or what the aims were around a competency document, the development of an e-portfolio, and to increase, all aimed at increasing the confidence, knowledge and retention of the staff, but also an e-portfolio that was portable, a passport between the different organisations and services for that collaboration and drawing on the expertise of the individual services. The competencies bring together those 4 levels of professional practice again, so there are outcomes associated with clinical practice, leadership, education and research, and identifies very clearly those expectations of new CNSs at 3, 6, 12 and 24 months onwards, with a supportive education programme of 6 sessions that the CNS and their mentor participates in over a period of time. And the pilot involved a number of CNSs that actually represented a third of the workforce across West Yorkshire to start with, and they were able to evidence their achievements in a core competency and portfolio document. The CNSs identified some key learning that they wanted to achieve during the Echo sessions, and these are some examples of those. And each session was facilitated by a topic expert and an interactive case-based discussion, which the CNS participants actually undertook themselves. And then there were mentor sessions to support them. So evaluation has been key throughout all of this, and we do that in a number of ways at the start and at the end to assess the competency, knowledge, but also the ongoing achievement of the CNSs at 6 months post the actual development programme. And we receive feedback from those who've withdrawn, although there's been very few, and there are quick polls at the end of each of the sessions. So we've got a range of evaluation data, which has all been very positive from the actual participants. I'm conscious of time, so I'm going to leap forward and talk about the value for money, the outcomes. This is very cost effective compared to accredited programs, and demonstrates the importance of sharing resources across different organisations and services, and has supported the practitioners to produce evidence for their portfolios, professional development plans, and be clear about their career aspirations. I'll move forward. We did create an e-portfolio, which I'm happy to share links to for colleagues who are interested. But I suppose the main outcomes and recommendations are that we're now on the 3rd delivery of this. We've got funding secured for the 4th and 5th programmes, and we want to create some specific programmes for children and young people's palliative care specialists, and also use the delivery model for other levels of practice as well. So it's opportunities to enhance and adapt the programme and its methods. The final thing I'd like to say is to send my very best wishes to the team who have been, are now finalists for the Nursing Times Workforce Awards and are at the Hilton today, hopefully fingers crossed, for that award this evening. However, they've achieved enormous work, regardless of whether they win or not as finalists. So I'd like to thank you and hope that it's been very helpful to share some of these national and regional initiatives. More than happy for people to email and to discuss them all in more detail in how we're supporting recruitment and retention in palliative and end of life care. So thank you.